The study of articulation and resonation starts with a review of vocal tract anatomy. Most speech sounds involve moving an active articulator, such as the tongue blade or dorsum or lower lip, relative to some passive articulator like the alveolar ridge, the harder soft palate, or the upper lip. Most active articulators ride on the jaw and are raised in part then by raising the jaw, which involves the masseter, temporalis, and medial pterygoid muscles. Our extrinsic tongue muscles move the tongue body to position it within the oral and pharyngeal cavities. The muscles that do this include the styloglossus, which runs from the base of the skull to the sides of the tongue, helps to support moving the tongue backwards and upwards. The hyoglossus, which runs from the hyoid bone to the sides and base of the tongue, which is used to move the tongue backwards and downwards. And the genioglossus, which runs from the interior of the jaw to the posterior base of the tongue and can be used to pull the tongue root forward. In terms of a visual image across our mid-sagittal vocal tract, the relative direction and effective action of the styloglossus, superior and posterior, hyoglossus, inferior and posterior, and genioglossus, inferior and anterior, are highlighted here. We do not have a muscle that directly raises the tongue upward and forward, but the myelohyoid muscle, which runs from the hyoid bone to the myelohyoid line on the inside of the jaw, provides a base that the tongue sits on. When this muscle is contracted, the base that tongue sits on is pulled upward and forward and becomes more tense, which can help raise and front the entire tongue body. So the location of the myelohyoid is indicated by the arrow with the dotted line. Contracting that then will help pull at the base of the tongue. And since the tongue is a fixed amount of material, when you squeeze it at the base like that, the material will end up going in the direction it can, given that the jaw is in the way in the front. That's going to move the tongue body forward and upward. Our intrinsic tongue muscles shape the tongue body into more specific postures. The superior longitudinal muscles, that are muscles on the superior surface of the tongue spanning the length of the tongue, are used to curl the tongue tip up. The inferior longitudinal muscles, which run on the inferior sides of the tongue, are used to curl the tongue tip down. The vertical muscles run from the top to bottom throughout the tongue body. They can be used to flatten the tongue body, and vertical muscles in different locations can be contracted separately, so this flattening may happen only in one particular place. The transverse muscles run from side to side within the tongue body. These can be used to bunch the tongue body, and that has the effect of causing the tongue to bulge up in the mid-sagittal plane, and so that's useful for higher vowel sounds or consonant sounds. The lips are rounded and protruded by the orbicularis oris muscles, a set of muscles that circle the mouth. The lips are spread by the risorius muscles, which connect the cheeks to the corners of the mouth. The velum is raised by the levator palatini muscle. This action closes the velopharyngeal port during speech. Our nasal sounds in speech are then distinctive in that the levator palatini is relaxed and the velopharyngeal port remains open, and can even be pulled open by a muscle like the palatoglossus. Combinations of the actions of the jaw muscles, extrinsic and intrinsic tongue muscles, lip muscles, and the velum provide us with the building blocks to articulate our different speech sounds that will be covered later in this unit.